Good evening, everyone. Good evening, everyone that is interacting with this video. It's such a nice time to be back to the family. And on today's video, I'll be talking about the cleft lip. Okay, some people still call it the cleft palate. We shouldn't get it confused. Cleft lip or cleft palate, you're still talking about the same thing. Okay, so family, what is a cleft lip? If I would ask you, all right, just pause this video, you take out some time, look at the picture, and from the picture you try to derive an explanation or a definition for a cleft lip. Okay, so going by what I know, I would say the cleft lip is an opening or split in the roof of the mouth or lip. All right, the cleft palate is a common birth condition. It occurs along or as a part of a genetic condition or syndrome. All right, now we could say going further to look for another definition for a cleft lip. All right, I'm coming, let me on my hotspot. All right, going further to look for another definition of a cleft lip. All right, you could see another picture here. This another child with the same issue. All right, so you could see another picture here. This one is so bad, and this picture here actually shows a surgery correction. You could see it was step by step. Yeah, you could actually pause this video and actually observe what we see here. Okay, going by another definition of a cleft lip, we could say a cleft lip or cleft palate are facial or oral malfunctions, malformations that occur very early in pregnancy while the baby is developing inside the mother. Clefting results when there is not enough tissue in the mouth or lip area. Okay, so now this is like fast forwarding to what causes cleft lip. Now in what we have here, we say in most cases the cause of cleft lip or cleft palate is unknown. These conditions cannot be prevented. Most scientists believe clefts are due to a combination of genetic or environmental factors. There appears to be a greater chance of clefting in newborn if the sibling or parent or relative had the same problem. Okay, now we could say actually clefting, we could say the causes are unknown, but going by the anatomical basis, we could say clefting results when there is not enough tissue in the mouth or lip area, and the tissue that is available does not join together properly. Okay, a cleft lip is a physical split or separation of two sides of the upper lip. All right, so going by what we have here, we could say cleft lip don't occur on the lower lip. All right, cleft lip mostly occurs on the upper lip. All right, so now let's go to another one. Another potential cause may be related to a medication a mother may have taken during pregnancy. All right, now the drugs you take when you are pregnant, they affect how your newborn will like turn out to be. All right, if you take some medications of which we are going to see, they can actually affect how your newborn baby will turn out to develop into. All right, so now we say that this are medication related to what the mother may have taken during her pregnancy. Some drugs may cause cleft lip and cleft palate. All right, cleft lip and cleft palate, don't forget, is the same thing. Among them are anti-seizure, anti-convulsant drugs. All right, so now I would like to leave you guys halfway. Let's be tackling these issues as we go through. So now we say anti-seizure. Let's get to know the meaning of anti-seizure drugs. All right. Anti-seizure drugs are drugs that are used to treat focal seizure. All right. They are also known as anticonvulsants. All right. Now we could say it's a type of drug that is used to prevent or treat seizures, all right, by controlling abnormal electrical activity in the brain. All right, are you guys still confused? Okay, now let's see what's the meaning of a seizure. All right, a seizure is a sudden, uncontrolled electrical disturbance in the brain. All right, electrical disturbance in the brain. It causes change in your behavior or movement or feelings. Now you know pregnant women, yeah, they got all those change in behaviors. Will I put it like that? Change in behaviors. All right. So among these anti-seizure drugs, you know, you have the Accutane, you have the methotrexate, you have the drugs commonly used for treating cancer, all right, cancer, arthritis, and psoriasis, all right. So this is how we move. So let's move to the next one. So we now know that most of the times the causes of cleft lip is not known, but most of the times maybe the drugs the mom took when she was pregnant can also result in causing cleft lip. All right, and most of these drugs are used in treating cancer, like we saw, and the rest. So these drugs can cause seizure, and seizure is like the sudden and uncontrolled electrical disturbance in your brain. All right, so now let's go to the next one. The next possible cause of a cleft lip or cleft palate. The cleft lip or cleft palate may also occur as a result of exposure to virus or chemicals while the fetus is developing in the womb. Now I want you guys to figure out a medium base. All right, let me say a mid course, all right, of the cleft palate that we are treating today. Now on the average, you could see that this usually occurs when the infant is still developing. All right, this to say that this disease is of the infant, this disease is for the children. Okay, you can't say that an adult will develop a cleft lip. No. This disease is infant related and occurs mostly when the infant is still in the womb process. All right, in other situations, cleft lip or cleft palate may be part of another medication. Yeah, that's the same thing, part of the medications. All right, it can cause changes in your behavior, movement. This is me talking about the effect of seizure. All right, because we have known that drugs used in treating seizure in pregnant women can also cause cleft lip, all right, or cleft palate. Now, drugs used in treating seizure can cause changes in your behavior, movement of feelings, and in levels of consciousness. Having 2 or more seizures at least 24 hours apart that aren't brought on by an identifiable cause is generally considered to be epilepsy. Now, don't digress much. We are just talking about cleft palate. We're talking about cleft lip, and we are just digressing a bit so that we could go into the root causes of cleft lip. All right. So now, what are the diagnoses? If you are a medical student, you are a nurse, you are a medical personnel, how can you diagnose cleft lip? Now, to me, I feel cleft lip is a physical stuff, all right. Cleft lip is not stuff that I need to take your blood sample to go test in the lab to know whether you have cleft lip or not. No, cleft lip is a physical thing, all right. So if you see a child, he has cleft lip, his mouth is like divided, you know, okay. So because clefting causes very obvious physical changes, a cleft lip or cleft palate is easy to diagnose, all right. Easy to diagnose. You see a child, his upper lip is divided straight up, you know that is cleft lip or cleft, or clefting or cleft palate, all mean the same condition, all right. So now let's go to the next one. What problems are associated with cleft lip? All right, a child that has cleft lip, a child that has cleft palate, what does the child suffer from? All right, eating problems. All right, you have a separated lip. How can you eat properly? All right, how can you eat properly with a separated lip? All right. With a separation or opening in the palate, food and liquids can pass from the mouth through the nose. Okay? When the child wants to eat, the food can pass from the mouth to the nose because some cleft lip issues are so let me say obvious. All right? Let me say obvious that like the separation is so much that literally when the child is eating, food can pass from the mouth to the nose. All right, what's the next issue? Ear infection or hearing loss. Children with cleft palate are at the risk of ear infection since they are more prone to fluid buildup in the middle ear. Do you know why? Because your mouth, your nose, and your ear all are linked, okay? All are linked. All of them are linked. So, you know what follows, all right? You know what follows. When fluid is building up, fluid is building up in your mouth, okay, entering through your nasal, this fluid can also escape to your ears. All right, this fluid can also escape to your ears. All right, so now let's go to the next one. Speech problems. All right, you know that your lips help in trapping air. Your lips help in trapping air so that you get to pronounce words the right way. All right, you pronounce words the right way. Mostly letter S. All right, even when you have like a large space on your teeth, pronouncing S will be like S. Then imagine your upper lip is totally separated. You have a lot of issue pronouncing words. All right, so now let's read through. Children with cleft lip or cleft palate may also have trouble speaking. These children's voice don't carry well. The voice may take on a nasal sound. The speech may be difficult to understand. All right. Lucky enough, cleft lipping can be corrected. This can be corrected. All right. So we'll actually get to know how this is treated. All right. Let's go. Dental problems. All right, children with clefts are more prone to a larger than average number of cavities, often having missing or extra malformed or displaced teeth, requiring dental and orthodontic treatments. I don't know if you guys are following me up, but uh, I really think if you have a separated upper lip as a child, that you can't really take care of yourself, then imagine you are presented with this issue. I think it's a big issue. All right, what is the outlook? What is the treatment for children with cleft lip? All right, okay. Although treatment for cleft lip or cleft palate may extend over several years, it also requires several surgeries depending upon the involvement. Most children affected by this condition can achieve normal speech, eating, and normal appearance. Now we could say praise the Lord. All right, we could say praise the Lord because surgeries can actually correct this issue. All right, so now let me just get you through this surgery stuff. It actually requires correcting the mouth. Let's go back to this image. Can you see on this? You could see the fix like an iron in the teeth. All right, now you could see with time his lips are correcting, and you could see he's a fine boy here. All right, so this could be correcting. This could be corrected. All right. So now another up tip: a cleft palate or repair is performed at 12 months. That's when you give birth to the child. Mostly before the child clocks a year, you should try to treat this. All right, because the tissues are fragile and they regenerate so fast. So any surgery correction that can be done to an infant will actually get to fix up. All right, you could say okay, create a working palate and reduces the chances that fluid will develop in the middle ear. All right, okay. So as if you don't want to correct a cleft palate through the surgery method, not that you don't want to control it through the surgery method. Apart from the surgery method, all right, there are some other treatments that you should give these children. All right, children often need treatment beyond surgery for cleft lip. Some other treatments their health providers may provide are speech therapy. All right, speech therapy, like okay, you make the child practice how to speak after the surgery. All right, the child practice how to speak. All right, okay. So now I'm just getting you back to the pictures, and actually the most important thing I want you guys to get through this lecture is cleft lip can be corrected. All right, and you usually do this before the child clocks a year, because when you give out to a child, you see the condition is there. All right, so you usually do it when the child is still an infant. Now, why is the reason for this? Because infants have a large a rapid division of cells. The cells are dividing so rapid that any surgery conducted on them can actually fix up ASAP. All right, so you do this to save a child. You do this to save a child from trauma, because I've seen people who have grown with cleft lipping. They don't really fix into the society that much. Okay, they don't fix into the society that much because they are shy. You won't really have that dope view that you are supposed to have. All right, so please, once you see a child with this condition, please, you push for the surgery so much. So how do you prevent cleft lip? Having a baby born with congenital anomalies like cleft lip or cleft palate is unpreventable. All right, however, you can do things to reduce your risks, like avoid using cigarettes, alcohol, and certain medication. Okay, So pregnant women should actually take caution of the medications they take in. Okay, so most of the times you talk to your doctor, you don't take medications into your hand, you don't take over the counter prescribed drugs. Okay, you talk to your doctor, how far I'm pregnant and I have this issue. All right, I don't want it to affect my baby, so what is the right medication for me to take? Should I take drugs or injection? So you speak to your medical personnel so that we'll fix hands together and we prevent these issues. All right, so I love you guys, and this is my my tip on cleft lipping. So see you guys on the next video. If you haven't subscribed to my channel, subscribe to my channel, because I have a bunch of 1,000 videos I'm to upload on this channel, and we are going 50 videos in a week. All right, have a real talk medical channel for you, so you subscribe so you get every feedback I'm bringing in. All right, thank you guys.